Coming to the semimembranosus muscle. So this is a deeper muscle on the back of thigh. It takes origin from superolateral area of the ischial tuberosity. Okay, so here on the superolateral aspect of the ischial tuberosity it takes origin. Then in the upper part and all it is membranous in appearance. In the lower part it is forming a belly. So it is a muscle belly. Then it passes medially and gets inserted into the medial condyle of tibia. So on the posterior aspect there is a depression which gets inserted into the posterior aspect of medial condyle of the tibia. Okay, so this place we will be seeing the insertion of the semimembranosus muscle, and it is supplied by the tibial part of the sciatic nerve. Tibial division of the sciatic nerve, or simply the tibial nerve we can call it. And so it also causes flexion at the knee joint. That is the reason this compartment muscles is called as flexor compartment. Okay, and it there causes the weak extension at the hip joint, and it also causes the medial rotation of the thigh as well as the knee. Next, coming to one more muscle. So that is called as ischial head of the adductor magnus. So here, so this part is called as the ischial head of the adductor magnus muscle. Here this arises from the ischial tuberosity, but the insertion is different. Okay, so it gets inserted into the shaft of the femur, posterior aspect of shaft of the femur. So here the medial aspect of the gluteal tuberosity, then it passes downwards into the linea aspera, then medial supracondylar ridge, and here finally it gets inserted into the adductor canal of the femur. So here we have the adductor tubercle, so which gets inserted into the adductor tubercle on the posterior aspect of the lower end of the femur. Okay, then here we will be seeing another ligament, okay, of the knee joint, that is called as Tpl Collateral Ligament. Okay, here we cannot see it. So this Tpl Collateral Ligament is nothing but the degenerated tendon of the adductor magnus muscle. The degenerated tendon of the adductor magnus forms the Tpl Collateral Ligament. Through that ligament it gets inserted into the tibia. Through that ligament only it is having connection with the tibia, or else it is just getting inserted at the level of adductor tubercle only. Okay, so that is the reason the adductor magnus it's not coming under the true hamstring muscle, even though it takes origin from ischial tuberosity, but the insertion it is not meeting the criteria. It gets inserted into the adductor tubercle only the femur. Only the degenerated tendon of adductor magnus is forming the tibial collateral ligament. Through that ligament it gets inserted into the tibia. Okay, so coming to the another muscle which is not the true hamstring muscle, called as short head of biceps femoris. So here the short head of biceps femoris also not taking origin from the ischial tuberosity. It takes origin from the femur. So that is the reason the short head of biceps femoris also not coming under as a true hamstring muscle. So when comes to the true hamstring muscles, the semitendinosus, semimembranosus along with the long head. Whereas short head of biceps as well as the deep muscle, the adductor magnus, both coming under the, they should not able to meet the criteria of all the hamstring muscles, So that is the reason, so they are not coming under the true hamstring muscles. So with this we have finished about the various muscles in the hamstring compartment and their attachments as well as the nerve supply and actions. Okay, so this is how you have to identify the various muscles, and you have to learn about the attachments, nerve supply as well as the actions. So another one more important content in the back of thigh is the sciatic nerve. Okay, so it is a very prominent structure, very thickest nerve in the human body, and it is 2 centimeter wide in appearance. So that is called as sciatic nerve, which supplies the back of thigh structures. So coming to the course of the sciatic nerve, so first initially it begins at the pelvis. So it begins at the pelvis in front of the piriformis muscle. So this is a piriformis muscle. In front of the piriformis muscle it arises. Then it descends downwards between the ischial tuberosity and greater trochanter of the femur. So it enters into the gluteal region between the ischial tuberosity as well as the greater trochanter. So then it descends downwards with lateral convexity. See here, so this is how it will forming a convexity here. Then it enters into the back of thigh. So this is the back of thigh. So this is the place where you will be seeing the sciatic nerve at the back of the thigh, just below the lower border of the gluteus maximus muscle. So see here, so this bulkiest muscle is called as the gluteus maximus. So the lower border of the gluteus maximus muscle, we will be seeing the passage of the sciatic nerve into the thigh. Okay, so in the back of thigh, it is situated deep to the muscles and it is supplying the various muscles. So we have seen the 2 divisions. Okay, so in the back of thigh it passes like this and it is supplying the muscles, and so at the superior angle of the popliteal fossa it gets divided into 2 more branches, the terminal branches of the sciatic nerve. So medially it forms the tibial nerve, laterally it forms the common peroneal nerve. Okay, so this is how we will be briefly seeing the course of the sciatic nerve. And if you coming to the blood vessels, so here the back of thigh muscles are mainly supplied by the perforating branches of the Profanda femoris artery. So here on the anterior compartment you will be having the femoral artery. So this femoral artery gives off one deep branch that is called as Profanda femoris artery. Okay, so still deeper we will be observing the Profanda femoris artery. So the Profanda femoris artery and its perforating branches are main contribution of the blood supply to the muscles of the back of thigh. Okay, along with that you will be seeing the inferior gluteal arteries also supplying the back of thigh muscles. Okay, so to summarize, so you have to learn what are the various muscles which are forming the hamstring compartment and what are the various characteristic features to be called as a hamstring muscle. Okay, and you have to learn about the various contents, like the most important content is the sciatic nerve, the course as well as the termination. Okay, so thank you all.